Oh, perfect.
Okay.
We're recording.
We're recording.
All right. Welcome back to the Common Sense Medicine podcast. I am Tim Chen. I'm a family physician. I have interest in prevention, population health, integrative medicine, and I'm joined with
Melissa Wood, nurse practitioner. I am a family nurse practitioner and have additional training in lifestyle medicine.
Awesome. Melissa, I'm glad you're here again because last time we had a good time.
Yes, it's been great.
Yeah, except for, the lawnmower guys at the back.
Yes, it doesn't look like it's a lawn mowing day, though. So.
Yeah, I think fall is finally here. It's still hot as all get out. But today, the point of the Common Sense podcast, a Common Sense Medicine podcast, is to really focus in on making complex medical things common. Right? We always say knowledge is power, but we realize medicine a lot of times is just kind of confusing. So most people have a hard time figuring out what to believe. They go on Google. Google says they're going to die. We want to be that source to really help people better understand complex medical problems.
Right. Yeah. And I think just we hear the same questions and concerns over and over. And it's things that maybe we think that everybody should know and just kind of be part of their own knowledge bank. And so we're here to kind of help to spread the word.
That's right. And we want to be funny and good at it and entertaining. So people that listen to this when you're doing your dishes or driving a car are not falling asleep out of boredom.
Yes.
Right. We don't need another medical lecturer.
No.
So now today's podcast is actually pretty interesting because we'll be talking about flu and sinus infections and colds.
We are in heavy flu season and just all things upper respiratory right now. So kind of hit early this year. So
yeah, I would say I do not remember ever being so busy with flu in like October.
No. October, early November. I think most people were caught off guard. A lot of people still haven't had their flu shots or were just waiting until a little bit closer to November, and then they got the flu.
It's too late.
It's too late.
Yeah. So I'm sure people are listening. Everybody knows somebody who's had the flu. If not, their entire family has had the flu already. And you're right. There's definitely been changes in viral patterns probably since the whole COVID lockdown, 2 years of shutdown. There are theories of what we call immunity debt, which is, I guess, a relatively new term, but at the same time, we've never shut the world down for 2 years either. So novel things are happening, but no worries. We're here. That's right. We're here.
We are still here.
That's right. And we're here to help walk people through, flu season. We're going to be talking about, what is flu, the flu shot, treatments for flu, over-the-counter medications. We'll be talking about sinus infections, Decadron shots, antibiotics, when to start them, when not to, and even talking about some lifestyle things that can help people keep their immune system strong to get them through this flu season. And hopefully we'll make it to Christmas and not have to, miss out on those things.
Yes. We want to keep everybody well for the holidays and, feeling their best. So
okay. All right. Well, Melissa, we are going to start off with flu today. So flu is a virus.
Yes.
All right. So let's go ahead and put that out. It's a virus. Antibiotics do not work on flu. Flu is also not COVID.
Yeah, not the same.
Yeah. We had some people. Go ahead, Melissa. I think
that's okay. Yeah, I think there's some people that still are under the belief that maybe they're the same thing, but no, they are completely different viruses.
Yeah, so
just in case.
Just in case.
Yeah.
Obviously, the past 2 years we have not seen a lot of flu. There are theories of things called viral interference, where when one virus is predominant, it's hard for other viruses to get in. And that's something that we've seen probably in history, but that's not for this podcast. The important thing, though, is flu can be serious.
Yes.
Flu kills a lot of people. In fact, I think before the pandemic, 350,000 hospitalizations, 30,000 deaths on average. I think what makes flu a little different than COVID is it hits the elderly and vulnerable like COVID did, but it hits children. Mm-hmm. And COVID didn't. COVID really spared kids for the most part, but flu, not so much.
Yes, it hits kids pretty hard, especially going through schools. We're seeing a lot of that right now. And yeah, you put a vulnerable kid with the flu, it can get bad.
Yeah. So, Melissa, what are some of the maybe symptoms if somebody wakes up with symptoms that make them think, hey, this might be flu versus just some other cold?
Yeah, so flu is a pretty rapid onset. Most people can pinpoint the hour, if not the minute, that they start feeling bad, and usually has some body aches, chills, definitely fever in most cases, usually a pretty high fever. Most people that have the flu, we're not surprised that it's flu. It's not like, oh, this person looks a little bad, let's just check for flu. Mm-hmm. It's usually like, oh, they've got the flu. It's a very specific set of symptoms in most cases.
Mm-hmm. You're exactly right. Yeah, most people have said, I feel like I got hit by a bus.
Yes, and, fatigue. Burning, kind of watery eyes sometimes too. And then, of course, the upper respiratory symptoms, some runny nose, sneezing, cough.
Mm-hmm. Yeah, I would say this year, a lot of people with flu came in with sore throat. So I don't know. That's, of course, that's part of the upper respiratory thing, like you said. But sore throat, dry cough, sudden onset. If you have those symptoms, flu starts moving up the chain of things that it could be.
Right.
Yeah. But luckily, there are some things we can do for flu. So let's actually start with the prescription side, Melissa. So obviously, coming to the doctor, getting tested, specifically if you have these symptoms, can be helpful. But with treatment for flu, there's a time period. Do you want to talk about that?
Right. Really getting in pretty soon after your symptoms start. Now, some will say wait maybe 24 hours, kind of see how this goes. And that way, we have enough viral load to test positive. But for the most part, we do want to get you in that first couple of days just because the antiviral medications work best when started early. So that will help kind of slow the progression of symptoms and hopefully get you feeling better faster.
Mm-hmm. Yeah, and I think the two that we have here in this area, Tamiflu, Zufloza, both of them work. Now, you're right. These are not like miracle drugs. It's not like you take them. Although I took Zufloza one time.
It might be a little small miracle.
I was like, I need to buy stock in this company. It essentially what it does, it helps with viral replication. It can help shorten the duration of how bad you feel, maybe make you even feel a little better. The ability for it to stop transmission, that data is still not quite there. But, personally, yeah, taking Tamiflu can be helpful. Now, I'll say for children, giving them Tamiflu, it's kind of like wrestling an alligator.
Yes.
It can cause a lot of nausea, a lot of abdominal issues. I don't know if you ever gave your kids.
Oh, yeah, and they usually throw it right back up. I mean, if you can get them to keep it down, they feel better. I mean, really after a couple doses, in my experience. But yeah, it is hard to get it down. Maybe, making sure they've got some food on their stomach, that kind of thing, just to kind of help. But yeah, sometimes it just does cause that nausea. So.
Oh my gosh, girl. I remember we were going to Disney. And my children had the flu, and I was like, no, we paid too much money to go. So we got the Tamiflu. It was like $300, insane. And my kids were just throwing it up. And it was like, you just threw up $30. Yes. Like, no.
It's like liquid gold.
Yeah, exactly. And I mean, right now, so I guess for the people listening in Mississippi, there is shortages of Tamiflu.
Yes, I think we got hit hard with flu all at once and maybe just didn't have enough stock, in as far as the pharmacies and things like that. So they've had a little bit of trouble finding it in some cases, but I think most of the time we can just check with other pharmacies, see who has it that day, and we've been able to get it for most everybody.
Yeah. So like you said, I think the key with this one is you want to start early. Obviously, the earlier you have the symptoms, the faster the medication works. If you wait till past 48 hours, the data really isn't there that it does a whole lot. So after that, you're just kind of, on your own, which there's things we can do for that. Now, obviously, we talked about Tamiflu, flu shot. Let's talk about that because obviously the COVID vaccine thing had some good things. Now it's just kind of a disaster as far as messaging, getting people to take it, and even whether it does a whole lot. But flu shot, the technology's been there a lot longer. What it does, essentially, kind of like all vaccines, it just tries to teach your immune system the virus, right? So like any other virus, the first time you get it, it sucks. COVID, same thing. First time you get it, immune system, never seen it before, really has to learn to fight, really has to learn to adapt. And that's what we call the adaptive side of the immune system. But the second time it sees it, faster response, more aggressive response, works better. And that's what the flu shot is there for. And so while most people, I'll tell you this. So speaking of people, questions that people ask, a lot of people tell you, Melissa, hey, I got the flu shot. I got the flu right after. What is that they're feeling?
Yeah, so sometimes it's the symptoms of your immune system just going through that learning process. So yeah, maybe some body aches, some general fatigue, maybe even a little low-grade fever in some cases, but usually not even quite that much. But yeah, that kind of is a sign that your immune system is working. Now, if they truly show up with high fever a few days later, they probably just got exposed to flu or whatever they happen to have at the time before they got their flu shot or shortly thereafter, because it does take a little bit of time to actually be effective.
That is a good point to bring up, Melissa, because a lot of people will say, like, I'm going to get my flu shot, and then I'm going to the birthday party full of flu people. So you do have to give it, like, about, on average, 2 weeks or so for the vaccine to really get going. And with flu shot, I like to, always remind people, flu, the virus itself, the reason we have to have it yearly is it mutates like no other. Like, at any one point, you can have multiple different variations of flu in Mississippi all at the same time. And the flu vaccine that we have, usually it's, 4 strains. We kind of look at Australia, look at some other countries that have had flu first, try to figure out what strain is dominant, and then we grow those strains, deactivate them, and that's what we use to make the flu shot. But, you have 10 different strains going through, you've only covered 4, there's chances that maybe they miss. And that's why sometimes people will see that flu shot might only be 50 or 60% effective that year because the predominant strain now is not what we had in the shot. But, better to have 4 covered than 0.
Right. Yeah. And I think maybe that's part of the reason why we've seen so much all of a sudden right now. Like we said, a lot of people haven't had their flu shot. And so, a lot of people weren't protected, but I think, as flu season moves on and more people get covered, hopefully we'll see less and less and maybe less severe cases.
Mm-hmm. Yeah. Oh, totally. Yeah, because I've heard, our hospitals are definitely getting full with flu, RSV, all these things. And so hopefully, like you said, as the flu shot catches up, that will help out. And like you said, that's another thing that makes flu shot different than COVID. The COVID vaccine, right now, what they did was they waited for BA.5, which is the predominant Omicron, to blow across the United States. And then I'm going to vaccinate you. So that's kind of backwards. Flu is really trying to be proactive, right? I'm guessing that these might be the strains that are coming through. So if you haven't gotten a flu shot, strongly recommend getting a flu shot, specifically for this year, because it's definitely a little rough out there.
Yeah, and this won't be our only wave. It's an early wave, but we'll probably get another one maybe around Christmas, New Year's. Usually January and February are still pretty heavy flu.
Mm-hmm. So definitely, our vulnerable population, our older patients, nursing home patients, same thing, diabetes, obesity, high blood pressure, these put people at higher risk for worsening flu cases. And kids, if you hadn't got your kids to get their flu shot, we would recommend getting it because flu definitely, they look puny. They definitely get their feelings hurt on when they...
For sure.
Yeah, and as a parent who needs sleep, if you don't want to be up, trying to pour $100 medicine down your kid's throat and watch them throw up, you might want to give them a flu shot.
Oh, for sure.
Yeah. So, all right, now, Melissa, we're moving on. We're going to talk about now sinus infections. So patients often come in and they're like, I need a Decadron shot. I need an antibiotic. I've been sick for 12 hours. Like that, that is not always helpful because most of the time, sinus infections are viral. Mm-hmm. And by most of the time, we're saying like 95% of the time. But, there are some symptoms that can help distinguish, or maybe lean that, okay, this might be a bacterial infection. This might be something where antibiotics can be helpful. And I would like to say one of the first things that we usually look for is time.
Yes. So usually, like you said, in that first 12, 24 hours, you don't even have to come in if you think you're starting to develop a sinus infection. As long as you're, fever-free, doing okay, you can kind of manage at home. But yes, time does matter. And if we're getting into that, if something is self-limiting, usually around day 5 or so, we're starting to feel better rather than worse. But if by day 5 or so, you're still progressively worsening each day, new symptoms are arriving, different things like that, then that may be time to look into, do we need an antibiotic for this? So.
Yeah, no, you're exactly. See, Melissa, I took notes this time. So yeah, obviously, that's always been a hard part, trying to distinguish between what's bacterial and what's viral, because antibiotics don't work on viruses, right? Antibiotics, if you're writing an antibiotic for someone who has a virus, all you're giving them is side effects, because there is no benefit for that. And if anything, you could actually breed more resistant bacteria in the future. So there is definitely this push for what we call antibiotic stewardship in the medical community, because we need these antibiotics, because these bugs, they get smart. And sometimes if you don't have an antibiotic to kill it, because we've been trying to use it inappropriately, that can cause problems in the future. But like you said, time is a big predictor. Most viruses, 5 days, 7 days, they're turning the corner. If something is lasting longer, the 7 to 10 day range, and you're still coughing and congesting and it's not going away, maybe not getting better, but not getting worse.
Mm-hmm. Yeah, I think that's an important
yes,
important thing to distinguish. Yes, so you will not be 100% by day 5 or day 7. You will not feel like your normal self, but you should at least be improving, turning that corner, maybe a little bit better each day. But yeah, you may still have a 10-day course of illness, mm-hmm. where you're sick and then gradually getting better. It is a gradual process. But yes, if things are progressively worsening by that, 5, 7, 10 day, mm-hmm. Definitely time to get looked at.
Yeah, for sure. And some of the other symptoms, I guess, based on studies trying to help people distinguish, one thing that is helpful is teeth pain. So I did not know this, but what they call, face pressure pain, teeth pain, that actually points to bacteria a lot more than viruses. A high fever. So obviously flu can cause high fever, but most sinus infections, they don't usually cause high fever. But if you have a 101, severe symptoms, thick nasal discharge and teeth pain, and it's day 5, that's probably the time to come in, let us evaluate, talk about antibiotics.
Yeah, I think that's fair enough.
Good. So the moral of the story is, don't come in on day 1.
Yes.
Unless you think you have flu.
Yes.
Yeah, give it some time. Now, let's say you're sitting in a house. So, right, we're talking to, you're so day 2, day 3, you're well, I don't feel horrible. I don't feel great. What are some things we can do? Because another thing patients will do coming in, they'll come in, it's been 2 or 3 days. You ask them, what have you done? And they're like, nothing.
Yeah.
And so we want you to do something,
Yes.
So Melissa, what are some things people can do at home?
Yeah, so some things that you can try at home. Definitely, if you're having a lot of congestion, some saline nasal spray can help. Just kind of rinse that out. Some Flonase can be helpful. And then, of course, for, headaches, if you do have fever, things like that, you can use some Tylenol, ibuprofen, just something that you have at home just to help with some of those symptoms.
Yeah, exactly. Yeah, please don't sit at home just being miserable by yourself. Right, Tylenol, ibuprofen, that is something that can be super helpful. I've had patients come and say, I don't want to take anything because I want you to see how bad I really look. I believe you.
Yes, I believe you. You can just tell me.
You can just tell me, yeah. I believe if you say, I had a fever, but I didn't want to take Tylenol because I wanted you to see me have a fever. Look, I believe you. If you say you have fever, you have chills, definitely, we believe you. So exactly like you said, there's data for, Tylenol with antihistamine. That actually has some really good, so that's like your Zyrtex, your Claritins with Tylenol that can help with symptoms. Like you said, nasal saline, rinsing out. That's physically rinsing out. So that would be like a neti pot oh my God, just these sinus rinses.
Mm-hmm. Yeah, just a little saline mist sprays, things like that's fine.
Yeah. So please use those things, don't just sit at the house.
Yes.
Now, as we move to our final page, okay, so we're going to spend some time now talking about maybe some natural things that people can do to get themselves to feel better. And this is actually focused a lot on the immune system, right? Because we have immune system for a reason. And I feel like during the pandemic, everybody learned all about their immune system and what it can do and what it can't do. But essentially what I want to tell people is, you have two parts of your immune system. You have the adaptive part, which is the antibodies, which is what the vaccines do. It trains that part of your immune system to fight. That is kind of like sniper, special forces. Like, I'm going to train them to fight this particular virus or this particular bacteria. And your immune system is very good at developing those things. But you have another part of the immune system called the innate immune system. So that is the part of the immune system that I tell people, it's the drunk frat guy at the bar that wants to fight everybody, all right? Doesn't matter who it is, what it is. And that part of the immune system actually is really powerful in children. That's probably why the kids, when you're first born, that is the part of the immune system that's super active. It's ready to fight. It doesn't need to see this thing the first time. It'll fight it. And there are things that we can do in our lifestyle to up the immune system, to up that innate part of the immune system, to keep that part healthy. And the first thing I actually want to talk about is this matter of heat or fever. So, Melissa, a lot of people, we just talked about treating fever, but there is definitely this matter of fever phobia. Like, the moment you have a 99, we need to treat it, but that actually can block some parts of your immune system.
Right. That's fever is your immune system way of basically killing whatever intruder it is. So it's actually a useful tool, and fever definitely can make someone feel very bad. So it's okay to treat it for those very high fevers. But if you or your child has maybe like 99, 100, low 100s, and are doing relatively okay, it's okay to let that fever ride, and just kind of keep an eye on it, still check it periodically, but it's okay not to treat that. That's your immune system's way of doing its job.
Yeah, exactly. I tell people, when people have fever, it's kind of like you ever play Pac-Man back in the day?
Yes.
And you eat the little big glow ball, and all of a sudden, like, the ghosts turn colors and they slow down, and Pac-Man speeds up and just starts eating the ghosts. Who knew the Pac-Man maker was such a biologist? But that's exactly what fever does. So it speeds up your innate immune system, the part that just fights everybody. It actually slows down bacteria, it slows down viruses, it allows your immune system to fight better. And we can actually replicate that with hot showers. So actually, this was a study done a long time ago. Some military personnel, they put them in a hot shower, put them in a hot tub, raised their body temperature, and they were able to see that their interferon, these hormones that the body makes to fight viruses and bacteria, actually accelerate. They get better. It's like you said, if you have 103, please, don't.
Take some Tylenol.
Don't sit there and die. But, if you have a 100.5, or a 101, something low grade, or kids can tolerate fever a lot better. It's okay to, bundle them up, let it ride a little bit. You're not going to give them brain damage, Yeah. And that will really help the immune system speed up. Now, the second thing I actually want to bring out is this matter of sunlight.
Yes.
Right? And vitamin D. Because a lot of people take vitamin D.
Yes.
And vitamin C.
Yes.
And we have studies correlating higher vitamin D levels in the blood equals better outcomes in viruses and bacteria and sepsis and stuff like that. However, how we get our vitamin D is important, and probably the best and most efficient way to get vitamin D is just to be outside.
Mm-hmm. Yeah, and I think that's part of this time of year. We get less and less time outside, especially with the recent time change. We just lost daylight savings time.
Oh my gosh.
So yeah, getting in some outside time where you can, whether that's just going out on your lunch break rather than staying in the office, or wherever you can squeeze it in. And it doesn't take a lot of time, 10, 20 minutes is actually pretty sufficient. So
yeah, exactly. You don't have to go out there and get a tan.
No,
right?
No, the dermatologist would come after us.
That's right. They're like, you're getting around melanoma. Exactly. No. But yeah, usually 15, 20 minutes being outside, being in the sun, that's great for the mood, right? It elevates your mood. Getting the fresh air is really good. But definitely data showing that activating vitamin D in the system will improve your immune system, will improve severe disease outcomes. So like you said, instead of eating lunch inside, sit on your hood, in the trunk of your car outside, eat lunch. That's really helpful. So that's another thing that can be good. And even, when I had COVID, first thing I was doing was outside mowing the grass and cutting my bushes. I was like, I need this sunlight. And I felt better. You just feel better being outside.
Same with like the hot showers, things like that. Nothing really feels better when you're sick than kind of heating up, whether it's a shower or getting outside. For some reason, it really does make you feel better.
Yeah. And we got science, especially on the molecular level, and big studies that show that. Now, one thing I kind of want to bring up of things that can actually slow down your immune system is actually psychological stress and physical stress, both. But psychological stress is something, the reason I want to bring this up is we're getting near Christmas time, Thanksgiving time. I have a great relationship with my in-laws. Not everybody has a great relationship with their in-laws. But, no, there's more stress, right? Your kids have plays, they have, all these programs, you got family traveling, you got all this stress. Obviously, a lot of people's work, their deadlines. We actually have really, really powerful data that emotional stress. So there was a study done looking at people. We give them the rhinovirus, but we either give it to them and then we make them give a public speaking time, or we give it to them and let them rest. And adding that public speaking stress actually messes up their immune system.
So don't schedule any speeches this winter. Is that what you're saying?
That's right. No, we can talk on a podcast, but if I'm standing in front of 100 people, no, it just shows that, there is this aspect of being too stressed out. Like we always say, I'm so stressed out my immune system. I just got sick. There is actually some data to this. So I don't know, Melissa, you're the lifestyle guru. How do we control stress during the holiday season?
Well, yeah. Well, and I, way before I knew much about lifestyle, I remember sometimes the sickest I ever got was those years that, like heavy school stress, heavy, travel, family, just all kinds of stress. And now looking back, I'm like, oh, well, that's because I was, burning the candle at both ends, probably not sleeping, probably not exercising regularly, all those things. But yes, so things to do on a regular basis. Get some exercise, even if that's just short little bouts where you can fit it in. Getting adequate sleep is a huge one, like we talked about last week. Give yourself a bedtime, go to bed, especially when you're not feeling quite your best, get extra sleep. Also just making sure that, yes, managing stress. So there's all kinds of different things that you can do to manage that stress. Exercise, like we just said, but even just things like journaling, having a good support system with your family or friends, mindfulness, like meditation or yoga, spiritual time, different things like that can just really help to channel that stress into different, just to kind of ease some of the stress overall.
Yeah. And like I said, this almost sounds so common sense that right? Like when you're stressed out, don't neglect your nap time or bedtime. Don't neglect, exercise, because exercise actually has great data. And we're not talking about go do CrossFit, although
you don't have to. It's fine,
yeah.
But you don't have to. Yeah,
exactly.
You can walk.
That's right, you can walk, exactly. And we've got data that shows that just low, moderate exercise a couple of times a week actually boosts the immune system. So don't neglect those things. And again, it's almost like we know what to do. We know we should, take hot showers, be outside, get in the sunlight, but this is common sense medicine.
Yes.
Right, so we're going to bring it to the forefront to make sure everybody knows that there are things that you can do to boost your immune system. There are things that you can do when you do get sick, to treat this. But this is, our body is complex. Our body rarely is it the silver bullet.
Yes.
Like we talked last week, like one thing we fix, everything will be better. But, we've just got to take care of these things.
Yes. Yeah. It's not just a vitamin D pill to get you through the winter. Yeah. It's other things that all have to go together. Exactly.
Right. Vitamin D, vitamin C. Actually, the data for these pills actually isn't the greatest. Probably there's some data with people eating vitamin C, right? Or getting that from onions, from oranges and stuff like that can help out. But the supplementation side, the data really isn't that great. So I think we do the old-fashioned way, make sure you get your sleep, control the stress, stay off Facebook. Although, except for this, get on Facebook to like this page. But I feel like that's what I think is pretty good advice.
Yeah. Overall healthy diet. Yeah. Big part of that too. So.
Well, Melissa, I think we did a thing.
Yeah, I think that's great.
Yes.
One more thing. Why do people want Decadron shots?
Oh.
Talk about that. How could we talk about a whole episode of upper respiratory and sinus and not talk about a Decadron shot?
Oh my gosh. Decadron. Okay, so funny. So when I was in North Carolina practicing, Decadron shot wasn't a thing there. I thought it was really interesting. It wasn't a kind of movie in Mississippi that you're like, oh, Decadron's a thing.
Yeah.
Yeah. I don't know. When you're in Arkansas, I don't know if you...
Not as much. Yeah, definitely not as much. But it seems like in this area, that's the first thing people want and request it by name.
That's right. Yeah, that's the vitamin D. No, just kidding. So, okay, right. So Decadron is a steroid. Steroids, their job is to really help with symptoms. They don't really accelerate, make things go away faster. They don't do anything with your, from that standpoint. What they do is they help with symptoms. Because your immune system is so mad fighting, Decadron can calm that down sometimes. It can help dry up mucus in the nose. So it can make people feel better. Now, the data for Decadron is a little bit more hit or miss. In COVID, in the hospital with patients on oxygen, yes. But obviously, we're talking about outpatient stuff. Sinus infections, like severe with high fevers, high teeth pressure, face pressure, Decadron actually has some data to help that. So you can either do the shot version, you can do the oral, low-dose prednisone for 3 to 5 days. That has some data. Severe sore throat, where you cannot swallow. So strep, to the point you can't swallow. Mono, where you can't swallow. It's not routine that we add that on, but obviously we need you to eat and drink. And steroids sometimes can be helpful for that.
Yeah, I think that's great.
So yeah, I knew it. I had it in my head. But I'm glad you brought that up. So Decadron. Oh, and zinc. Sorry, I forgot to bring that up too. So zinc is common. The data for zinc is not daily. So daily zinc actually doesn't do a whole lot. But if you get sick and you start like zinc 50 milligrams right as you get sick for 3 to 5 days, that actually has a little bit of data on zinc. But you can also get zinc in onions and food. So we should just eat it.
Yeah, eat the food.
Yeah. Well, Melissa, again, we did a thing. We did another episode. I feel like we got a lot of information out there.
Yeah.
People who like the podcast, share it. I feel like this one's applicable because we're in flu season.
Yes, we're seeing it all right now. Everything's going around. So
Now, next week, Melissa, what do you think? Ozempic? You want to touch that?
I think so. I think it's, especially before the holiday season and before people start making their New Year's resolutions, I think we should tackle that one.
Yes.
Yes.
We should, because it's everywhere.
It's
Ozempic,
everywhere.
Mounjaro. So for the people that are on it, we're going to talk about it, how it's helpful, why it might not be the long-term answer at the end, cost, effect. And I think the lawnmower guy.
Yeah, I hear him coming.
Okay, so we're finishing on time. Well, thanks again, Melissa.
All right, thank you.